Hey rehab team, welcome back to the second video for the use of restraints. This video will go over emergencies, how to do a quick release, and the different definitions, signs, and symptoms to look for, and what you should do during different emergencies with a restrained patient. So the first thing is anytime there's an emergency situation with a restrained patient, you should be able to quickly release the restraints as needed. So the restraint should always be attached to the bed or whatever, if they're in a chair, to the chair with a quick release. We will go over in another video how you tie a quick release, but a quick release you should be able just to pull on the restraint as it's tied to the bed and it would release immediately. Otherwise there may be a buckle. You would be able to then just unclip the buckle. Or with the lock devices, you would actually have to unlock the device because there's a lock not only on the patient but as it's attached to the bed. There should always be a key either above the bed or with the at the nurse's station as you enter the floor, and so that's where you'll find the keys to release those devices. So different emergencies that you may run into with a restrained patient. The most common would be an asphyxiation or maybe a hanging. So an asphyxiation would be anytime something would get around the patient's neck and prevent them from properly breathing. This could be the restraint itself or another object that's around the patient. Obviously, signs and symptoms, the patient's going to have difficulty breathing, their face turning blue, or their veins in the head and neck are swollen, or change in the level of consciousness. So if you run into this situation, you need to call for help. Remove the cause of the asphyxiation. If strangulation is occurring and you can't get it out or off the patient's neck, you should cut the device that's around the neck. Clear the airway, and if needed, provide CPR if the patient is not breathing on their own. And then treat for choking as needed as well. And then once the patient is recovered, place them in a recovery position. If you are in a situation where the patient is actually hanging by strangulation, so this would be an object around the patient's neck, you need to remove the object from around the patient's neck. If you're unable to, you may need to cut whatever object is around the patient's neck, and then place the patient flat on a firm surface if they were hanging by something, and then begin CPR as needed and call for help. The last situation you may run into is severe bleeding. So with severe bleeding, if needed, depending on where the site of bleeding is, you may need to remove the restraint, and then you're just going to follow your typical things that you would with bleeding. So you're going to apply pressure to the area of the bleed. If it's a bad bleed, you may have to apply a tourniquet to stop the bleed, and then again making sure to call the nurse for help in those situations to come in and help you out. So that is kind of looking at the what you would do during emergency situations with a restrained patient.